But at the end, how the management, handle the situation is something that we will need to discuss as we, in the course of this presentation. Now, since all this thing is happening, now the core of this presentation is how do we prevent, or how do we, how do our staff respond to physical or verbal attack by patient or their relative when carrying out their duty. So responding to physical or verbal attack by patient or relative in the ward. Now, when faced with a physical or verbal attack by the patient or their relative in the ward, it is important to prioritize your safety and well-being, while also maintaining a professional demeanor that can give you leverage and in control of the situation. Below are some of the manners always which you can respond to. Now, number one, when you are faced with physical attack or physical abuse, as a professional, you should stay calm. Remain calm and composed. Even if the situation is escalating, still remain calm. Don't try to, respond. Don't try to respond to the patient in an angry tone. Then avoid taking the attack personally and focus on the escalating the situation. When the patient is angry and is, shouting, you as a professional nurse, or a health provider, you should remain calm. Arguing will not solve the problem at that point. At that point. Then, number two, you should assess the situation. Quickly assess the situation and determine the level of threat. We need to assess whether this patient, whether this relative that is so angry now, whether is capable. We should quickly, mentally, should assess that. Can his attitude lead to violence, so that you know how to, take care of yourself. Then the other one is consider the number of people involved, their tone and their body language, and potential for physical harm. How many of the patient relatives are, talking angrily at you? How many of them are there? Then how many people are around you that in case you have been physically attacked, they can come to your rescue? Number three, maintain a safe distance. You should maintain it. When somebody is threatening you, I think the most sensible thing is for you to maintain safe distance from that person or people, so that they don't attack you. Then avoid standing too close or allowing them to corner you. As they are talking angrily, you should try as much as possible to stay far away from them and make sure you are not cornered. And then you should call attention of either the security or anybody that could, give you cover at that point in time. Then use active listening. Use active listening skills to understand the concern and needs of the patient and relatives. As they are talking and you stay calm, try to understand what is their problem. What are they even talking about? What is the cause of their anger? If you are able to, identify the cause of their anger, at least if you are able to solve those problems, you will have, prevented being attacked. Then show empathy and acknowledge their feelings, but avoid taking blame or apologizing unnecessarily. Despite their anger, and despite the fact that they have, spoken to you in a very, very uncivilized manner, as professionals, you should still calm down, have empathy on them, have it at the back of your mind that these people, they are already stressed out before coming to the hospital. Maybe the cause of this, their anger, is because they are stressed out. At least if you think that way, it will calm you down too, as a person. Then de-escalate the situation. Use the de-escalating technique such as speaking in a calm and gentle tone to reduce the tension. Like I've said earlier, when they are speaking in a very bad manner, You as professional, you should speak, professionally and calmly to them so that you de-escalate the situation. Then avoid arguing or debating with the person and focus on finding solution. The person that is angry will try to make you understand that this is what you want. Don't argue at that point in time. Just try and try and do what you think will help the situation. Close your mind to arguing with that person. Just avoid argument with that person. Excuse me. Then, number 6, seek support. If the situation is becoming too intense or threatening, seek support from colleagues, security personnel, or hospital administration. When there are times where you have patient relative converging on the hospital staff, maybe to attack her or him, the right thing to do is you quickly call the attention of the security people, or you call the attention of your superior, or you call the hospital administration to come to your rescue. Then don't hesitate to call for help if you feel threatened or unsafe. Number 7, you should document the incident. Document the incident thoroughly, including the events leading up to the attack itself, and any consequences or outcomes. Yeah, we are now talking of if the attack has occurred, don't hesitate to document, because at times maybe the management may decide to take up this matter. If you don't have proper documentation of how the incident happened, at the end of the day, the patient the attacker might go scot-free. Then, including in your documentation, you should include any witness statement and description of any injuries or damage. Are there witnesses to the attack? Have you been injured? You should deliberate or document such incidents in your report. Now, report the incident. Report the incident to your superior or the hospital administration as soon as possible. Immediately this thing happened, you should call the attention of the hospital administration and report the matter. Follow the hospital policy and procedure for reporting workplace violence. In some hospital, there is in place, they have put in place way of reporting any incidents of violence. So if your hospital has such policy, you should follow the procedure. Then seek support and counseling. Now you should consider seeking support and counseling after such incidents to help you process your emotion and cope with trauma. This is an area that we need to talk extensively on. When this type of incident happen, some management at times, the way they handle it is such that they don't so much concern about the possible trauma such incident could have caused to the staff, for their staff. Maybe they just look at the incident, maybe treat the patient, the attack staff, or give some little touching, and that is all. They don't think that such attack will have profound psychological trauma on the staff. So, anybody that has been attacked deserve to undergo counseling. Don't underestimate the impact of workplace violence on your mental health and well-being. Just like we've just explained, any attack while you are on duty has a way of having some psychological effect on you. So if you have experienced such, it is better you seek some counseling or psychosocial support. Now review the incidents and improve. Now, since it has occurred, the hospital need to review the incidents, what led to such incident, how can such incidents be avoided in the future. So this is another area that the hospital management needs to look at seriously. Attack is happening on and on. It is very important for the management to sit down and look at ways of prevention. What are the causes of What are the triggers of this attack? So let them think of way of trying to avoid such from happening to the staff. Now work with your team and hospital administration to develop strategy to prevent similar incidents in future. Now let us look at the personal problems of nurses and other health workers